IMHpact is a group of agencies coming together to work under a philosophy of truly patient-centred care, so to improve the journey of mental health consumers, their outcomes and their wellbeing.
IMHpact annual forums year on year have grown, and I think really they always reflect where the sector is at. I think the essence of this year's forum is that it's around the individuals who are most important, which is those who are accessing mental health services in our community, and they're strongly represented here today, both consumers and carers and the organisations that work together to support them.
Doug, you go first. Okay.
Most people don't talk about the difficulties of the mental illness per se. They talk about the impact that services have on their lives, for good or for bad. What we don't spend a lot of time on is listening to the stories of people that have really found services useful and learning from that, and then multiplying that out in how we kind of replicate that. We're very good at listening to what's not working, but not so much what is working in people's lives.
So I've lived with mental illness now for 5 years, and it's only been the last 12 months that I've been able to come out and actually say that I've got mental illness and actually talk at a forum like the forum of today. And it's very important because it's a key ingredient in terms of me feeling empowered so I can head towards wellness. Empowerment is a key concept, because if you don't feel in control or empowered with managing your illness and managing the treatment of it, then it's hard for you to be in that position. I think my recovery has started to take place when I've taken more control of aspects of my life, and we've also combined that with an excellent medication. We'd had some trials of medications that didn't hold the depression, so I've got a good medication mix, but also I made some very big changes in my life and also have embraced diet and exercise.
I wanted to capture the very essence of the work that we do at Gallumbilla. The last thing I wanted to do was talk shop. So I wanted to capture something that we do around our social emotional wellbeing program, and that was the Healing Circle.
Circle's a place where we can all come together and connect in the truth of who we are as individuals. It provides an opportunity to create a collective story. So the circle that I run on a Tuesday is ran through the SIS program, which is ideally is about engaging people that have been a little bit isolated, a little bit disconnected, getting them back into the community in a proactive way.
I've lost some very dear people in my life, and the circle helped me find myself again and pull myself out of a dark hole, and I haven't looked back really, and I'm still going.
That circle itself for us and for the participants was a really, a major turning point. For them to go and show a bunch of people that they don't know how much they've grown was probably one of the most beautiful things that I have witnessed. It was true empowerment, and that's basically what Circle is. It's about this opportunity to understand who we are, and that's really generated through acceptance and non-judgment, and that's what Circle does.
Services are really, really important in people's lives, and yet they're not the central piece. And if services can play a pivotal role in helping people's recovery, it's to support them to stretch into that real citizenship, not to keep them closeted and safe and within a service, but to provide opportunities for people to have a go, to take a risk, to step outside the comfort zone, to experience themselves as their full citizenship, not as a service recipient. If services are able to do that, then services have done their job well.